everyone, and thanks so much for being here to talk about or hear about proton therapy. So let's start out by just talking a little bit about what radiation therapy is. So as we've talked about today, there are three basic types of treatment that we use to treat brain tumors in children, and actually that we use to treat cancer globally. Those are surgery, which is usually done to remove a tumor or part of a tumor. Chemotherapy, which is basically sort of a global word for drug therapy that travels throughout the body, killing cancer cells both where we can see them and where we can't. And then radiation therapy. Radiation therapy is the use of high energy particles and waves to kill cancer cells. It's directed at the area where the tumor is or where the tumor was. It only works where it's aimed though, so it does not travel through the body. It doesn't kill cells anywhere where we're not aiming it. The benefit of that is that it also only causes side effects right where you aim it. And the goal of radiation oncologists at CHOP and really everywhere is to determine the best ways to deliver the radiation where it needs to be delivered, which is where the tumor is or was, and to avoid radiating as much normal tissue as possible. And this is really of paramount importance when we're talking about our pediatric population. You know, children have growing central nervous systems, growing tissues that are particularly vulnerable to the side effects of radiation that's delivered to normal tissues, and so we're constantly working on ways of minimizing this so that we can deliver the radiation safely and protect those important growing tissues as much as possible. So what is proton therapy? Well, let's start talking first of all about what people mean when they say regular radiation or standard radiation. What they usually mean when they say that is radiation that's delivered using very high energy X-rays. X-ray therapy uses the same type of X-rays that you use to get a chest X-ray, except they're about 1,000 times the energy. When you think about getting a chest X-ray, generally the X-ray machine is in front of the patient. The patient stands right here, and then there's a piece of film behind them. The machine goes on, and there's an image that's projected on the piece of film, and that's how you get the X-ray image. And if you think about that, the reason that works is because X-rays travel into the patient and they travel out of the patient. They go all the way through the person. And that means that there's inherently an entrance dose where the X-rays go in and an exit dose where they go out of the patient. The reason that X-rays do this is because they don't have a mass and they don't have a charge, and so they just go in and they go out. The energy trails off a little bit through the patient, but not really significantly. Protons, in contrast, are actually particles, and because they're particles, they're very, very tiny, but in the world of radiation therapy, they're actually heavy and they have a positive charge, and for that reason, they actually stop within tissues. And with careful planning using both computer software and mechanical hardware, we can determine exactly where we want them to stop. We can make them stop in the tumor. At the point where they stop, they deposit a whole lot of their energy, and I'll show you a graph of that in just a minute. And then they don't exit the patient, and so you're able to spare all that normal tissue that would normally be exposed to radiation through the exit radiation dose. So this is a graph that depicts that. So on the vertical axis here, we're looking at radiation dose or radiation exposure, and on the horizontal axis, we're looking at the depth. Here it says in water, but really you can think about that, the depth in the patient. So the blue line is an X-ray beam, and you can see that the blue line enters and then it peaks its energy at about 2 centimeters inside the patient, and then it sort of trails off, depositing energy all the way along as it goes into the patient and out of the patient. The yellow and gray lines represent particle therapy or proton therapy. So what happens when the proton starts to enter the water or the patient is it stays at fairly low energy, and then right before it stops, it deposits about 90% of its total energy, and then it stops and it doesn't trail off at all. So what does this mean when we're talking about a patient? This is another graph. So here, you can think about this larger blue volume as being the head or the brain of a patient, and the smaller volume right here as being the tumor. All of these colored lines represent X-rays. So you can see that the X-rays start out from the machine. They enter the patient at actually a fairly high dose. They're only at about half of their dose by the time they hit that tumor at all, and then they trail off, leaving radiation all along their path. In a young child's brain, this means there's an awful lot of brain tissue that's getting radiated that has nothing to do with the tumor itself. This red line represents a series of protons. So when the protons enter the patient, they enter at a lower dose. Then they peak right at the tumor edge. We line up a whole bunch of protons, so that we create a dose right along the tumor and then they stop completely. So this half of the brain is getting no radiation at all. And we know from some really complex modeling that's been done, mostly at St. Jude's, that the number of neurons in the brain that are exposed to radiation directly impacts the neurocognitive effects or the IQ effects from the radiation on the brain. So the more sparing we can do, the more protection of the normal brain, the better. So what does this really mean for our patients? So these are some really fascinating pictures that show some of the differences between radiation therapy when we're using X-rays versus protons. This is a patient who actually needs radiation to the entire brain and spine. This is called craniospinal radiation, and it's a type of radiation that's used for a lot of pediatric brain tumors. So until fairly recently, we had to use X-rays to give this type of treatment. And what happened when we used X-rays was that this is the patient, and if you think back to Dr. Fisher's talk, the patient is in the sagittal, this is a sagittal view of the patient, so we're looking at them sideways, lying on their stomach. This is the spinal column, this is the back of the head, and these are all basically the organs in the front of the body. So we would give the radiation from the back, we'd give a nice uniform high dose of radiation to the spinal column, and the radiation would trail off because of that exit dose through the anterior organs, which meant that the heart got some radiation, the lungs got some radiation. We actually used to, for young girls needing this type of treatment, move the ovaries outside of the field so that they would not get radiation. That was an extra surgical procedure that they often needed. Now, we can use proton therapy to do this. And you can see again the radiation's coming from the back. We're giving that same uniform radiation dose to the spinal column, but it stops. And all of these anterior organs are not getting radiation. This is another view of the same thing. So this is an axial cut, as if you're looking at the patient sort of like a piece of bread. And you can see the radiation entering. This is the spinal column where the radiation needs to be. And here it is kind of trailing off through the heart and lungs. Now, we think that the dose that the heart and lungs was receiving from this type of treatment was relatively safe. We were very careful to be as safe as possible, but nothing is still better than something when it comes to radiation. And so we're very happy now that when we use proton therapy, the beam can actually stop at the edge of the spine, giving no radiation to the heart or the lungs. This is another picture of a brain getting radiated, and again, we're looking at axial slices here, so the patient's sort of like a slice of bread. You're looking this way through their head. And this is the plan that we were able to use with protons. You can see that there is still some extra radiation because this is the area where the tumor is. Where the beams enter the patient's brain, there are two beams, there's still an entrance dose, but then there is no exit dose at all, and all of this brain, which is up in sort of the thinking region of the brain, is not getting radiation. When we use an X-ray plan, there's a low-dose radiation bath that's being given to the whole brain, and our concern is, number one, that this can impact IQ and functioning, and also that it may increase the risk of cancers that are actually induced by the radiation treatment. So we're very happy to be able to reduce the radiation exposure as much as possible, especially to very young children. This is a graphic way that we interpret radiation plans. Here is basically the volume of the normal structure. And then on the horizontal axis, we're looking at the radiation dose. So let's look at the pituitary gland. This is for this patient, actually. When we look at the pituitary gland, the radiation dose that we use when we use X-rays is way up here in this pink line. When we use protons, it's reduced almost to zero. The right and left temporal lobes are important parts of the brain where a lot of important sort of thinking activities occur. And here you can see the dose to the right temporal lobe with X-rays, that sort of bluish line, versus protons where it's drastically reduced. The left temporal lobe is in green here with X-rays and here with protons. And then the cochlea, or the inner ears, are depicted by these sort of turquoise lines, and you can see their radiation dose is almost zero with protons as well. And when you're thinking about patients who may already have some neurocognitive problems from their tumor, their surgery, and their radiation, preserving their hearing is really extremely important for their school function. So we're very excited to have a proton center, and I thought I'd just show you a few pictures of it because we're thrilled that we're able to provide this treatment for our patients, and especially for increasing numbers of patients from around the world at this point. So right here you can see the cyclotron, which actually weighs 220 tons, and it came on a barge from Belgium down the Delaware, and was installed by Crane onto the campus across the street from CHOP. The building that it is housed in was built around it, actually, sort of customized specifically for that particular cyclotron. And this is a picture of our building now that was built around it. So CHOP is right here, right across the street. And then the entire concourse level of this building is the radiation center, with the cyclotron being over here. This is a picture of one of the treatment machines. This is Dr. Lustig, who's one of our senior radiation oncologists. This is the patient who's on the table and one of our radiation therapists who's delivering the actual treatment. And when they step out of the room, the proton beam will come out of this treatment head and treat the areas of the patient where it's directed to. Actually, currently, right now, CHOP does have the largest and most advanced proton therapy facility in the world. We have an independent pediatric waiting room, so we do share the machines with the adult hospital because the proton machine is so state-of-the-art that it doesn't really make sense to have two of them next door to each other. So we share with the adults, but we have an independent pediatric waiting room with a pediatric clinic with pediatric anesthesiologists. Many of our patients actually need to go to sleep every day in order to get the treatment because they're not able to hold still, they're too young. So they have anesthesia every day, and we have a dedicated team to do that. We have dedicated social workers, pediatric nurses, and child life specialists who are present all the time. We work really closely with the other doctors who are talking here today, as well as with our pediatric neuropsychology team. I think Dr. Armstrong is speaking next about doing our very best in terms of helping children both in recognizing any neurocognitive deficits they may have and dealing as assertively as possible with neurocognitive deficits that they may develop from treatment. Over the past 2.5 or 3 years since we've been open, we've taken care of hundreds of pediatric brain tumor patients from Philadelphia, from around the country, and actually from around the world. And we're continuing to actively study ways to improve this therapy as well as quality of life for children with brain tumors. So in conclusion, proton therapy offers unique benefits to children. I think you can see just from the pictures how much reduction in radiation exposure to normal tissue we can achieve with this technology. Right now, we have the largest and most advanced facility in the world, and we're continually working on ways to, improve this process even further with new technologies, as well as just new ways of using the technology that we have. And we've taken care of a lot of brain tumor patients, and we look forward to helping many more of them. So thank you, and I'm happy to answer any questions.